attracted extra billing by doctors and patients, while at the same time building the public insurance system. In 1999, the Prime Minister and most Premier reaffirmed in the Social Union Framework Agreement that they are committed to health care that has comprehensiveness, universality, portability, public administration, and accessibility. The system is the most part publicly funded, yet most of the services are provided by private enterprise or private corporation. Although most hospitals are public, most doctors don't receive an annual salary but receive a fee per visit service. About 29% of Canadians' healthcare is paid by the private sector or individuals. This mostly goes towards services not covered or only partially covered by Medicare, such as prescription drugs, dentistry, or vision care. Many Canadians have private health insurance, often through their employers that cover these expenses. The Canada Health Act of 1984 doesn't directly bar private delivery or private insurance for publicly insured services, but provided financial incentive for doing so. Although there were laws providing or curtailing private healthcare in some provinces, they can be changed according to reports in the New England Journal of Medicine. The legality of the ban was considered in a decision of the Supreme Court of Canada, which ruled in Quebec that the prohibition on obtaining private healthcare insurance, while it may be constitutional in circumstances where healthcare services are reasonable as to both quality and timeliness, it's not constitutional where the public system fails to deliver reasonable services. The appellant contend that the waiting times in Quebec violate our right to life and security in the Quebec Charter of Human Rights and Freedom.
You made me think there's something wrong. I'm not a man.
Healthcare in the United States. Healthcare in the United States is provided by many separate legal entities. Healthcare facilities are largely owned and operated by the private sector. Health insurance is now primarily provided by the government in the public sector, with 60 to 65% of healthcare provision and spending coming from programs such as Medicare, Medicaid, TRICARE, the Children's Health Insurance Program, and the Veterans Health Administration.
Clubs and weapons of war.
The United States doesn't have a universal healthcare system. However, the PPACA, Pension Protection and Affordable Care Act, as amended by the Healthcare and Education Reconciliation Act of 2010, seeks to have near universal healthcare insurance coverage to legal residents by 2014. It provides for federally mandated health insurance to be implemented in the United States during the 2010 to 2019 decade, with the federal government subsidizing legal resident households with the income up to 400% of the federal poverty level. The healthcare in Brazil. The healthcare in Brazil is provided by both private and government institutions. The Minister for Health and Aging administers national healthcare policy. Primary health care remains the responsibility of the federal government, elements of which, such as the operation of hospitals, are overseen by the individual states. is provided to all Brazilian permanent residents and foreigners in Brazilian territory, and is free at the point of need, being paid for from general taxation. The country is home to a number of international health organizations, such as the Latin American and Caribbean Center of Health Sciences and Information, and the Endowment Institute for Education in Medicine and Health.
Violence, and nothing ever could. For all I was born beneath that.
Healthcare in Europe. Virtually all of Europe has either publicly sponsored and regulated universal health care or publicly provided universal health care. The public plans in some countries provide basic or sick coverage only. Their citizens can purchase supplemental insurance for additional coverage. Countries with universal health care include Austria, Andorra, Belarus, Vienna, Bosnia and Herzegovina, Bulgaria, Croatia, Czech Republic, Denmark, Estonia, Finland, France, Georgia, Germany, Greece, Hungary, Iceland, Ireland, Italy, Latvia, Lithuania, Luxembourg, Malta, Moldova, Monaco, the Netherlands, Norway, Poland, Portugal, Romania, Russia, San Marino, Serbia, Slovakia, Estonia, Spain, Sweden, Switzerland, Ukraine, and United Kingdom. The biggest example of the healthcare area is the French healthcare system. It is one of the universal healthcare largely financed by government national health insurance. In its 2000 assessment of World Healthcare System, the World Health Organization found that France provided the best overall healthcare in the world. In 2005, France spent 11.2% of GDP on healthcare, or $4,000 per capita, a figure much higher than the average spent by countries in Europe. Approximately 77% of health expenditures are covered by government-funded agencies.